go through a public process, and that's not something that's tied to the discussion about masks. I think that having that in our code has a value, as has been discussed.
Thank you. Colby?
Yeah, I think it has a value as well. I'm just kind of curious as to how that works in action. So say it was adopted, and I guess what happens beyond the process of adopting that, like if we need to use it.
Could you address that, Annette?
Sure, or Bill can, but I believe it would be similar to what has happened already, which is the legal authority is established in the code, and it defines what types of orders you can issue, in what circumstances, and for how long, and it has all of that detail in there. And then if you needed to issue a public health order, we would come to you as staff with the factual basis for it. And then it would be a resolution like you've adopted with the mask requirements that would be under the authority of that code. Am I correct, Bill? I think that's how it works.
Yes, that's correct. Basically, what you're doing is you're putting a tool in the toolbox in case you need to pull it out later.
Okay. Does that make sense, Colby? You got your question answered?
It would still be a council, unless it's like a very high critical emergency where I needed to issue something, but I would still have to come back to you within 7 days to have the council approve anything. So there's still a council process for issuing any order under that authority.
Correct.
Yeah, thanks. I think that answered my question. It's just kind of hearing a permanent state of emergency, is what it.
Oh, no, it
like.
doesn't mean there's a permanent state of emergency.
Yeah, I know, but it opens up the ability for, I see all the positive sides of it and the ability to react quickly. But I guess the concerns is that it opens up the ability to react quickly and then come to council after the fact to get approval for, if a decision was made, you can't change that decision a week later, of what the outcome is of that. So I guess that's a little bit concerning to me, but I think having the ability to act quickly is important.
So I think it's really important. I would support that. I'm going to go back and see if Tom is able to talk to us. I wanted to get your thoughts on that, Tom. Do you feel we should give direction to city staff to begin the process of a public involvement, doing the hearing, to have an emergency powers ordinance on the books as described tonight?
Oh.
Go ahead.
Oh, I was just saying my internet says I'm having internet difficulty on my computer, and I'm here at the city office. So are you guys hearing me? It looks frozen on my screen.
I'm fine. This is Mike.
Okay. All right.
Yeah, I can hear you really well.
Yeah, this is Bessie Joe. I just wanted to let you know that Tom texted me and he's having technical difficulties.
Okay. Annette, this first of three items, do we need to provide direction to you, or does there need to be a motion? Tell me the right procedure. There seems interest in this emergency powers.
just need to give direction that you're interested in staff working on this. The formal process and your approvals and everything will happen during the actual public hearing process and the procedures that are laid out in the state law. I just need to know if you want me to work on this and actually prepare something to bring back to you and go through the planning commission and everything to get this done.
Yes, what I heard was that we don't know what Tom's position is. We could perhaps text him for the record, but I heard Melanie and Colby and I think Mike was fine with it. So I would say, the council would like to give you direction to develop that option for us to vote on at some future point, like the end of October, you said.
Okay, thank you.
Now, those of you that can hear me,
Mhm.
did I characterize that correctly? Or do you have a strong opinion against what I just said?
Oh, good here.
I'm in agreement. It's Mike.
Thanks, Melanie and Mike. Colby, you okay with that?
Yeah, I'm okay with that.
Okay. Great. So I don't think we need a roll call vote on that, and hopefully we'll get Tom back on here pretty soon. Let's go to the second item. And the second item is do we want to extend? And this is again a separate from emergency powers, because the current emergency powers goes till September 18th. So do we tonight want to adopt resolution 20-20 extending the mask mandate, which would run through September 18th? If we were to do that, there would be some kind of a gap between September 19th and the end of October, or perhaps if we didn't adopt the emergency powers ordinance year round, those are my words, then we would fall under the counties and the Central District Health guidance and direction and law on September 19th from then on. The other option, option 3, would be to let the McCall City ordinance lapse or run out the clock on September 1st, and we would go under the county and the Central District Health's guidance, and also their form of law enforcement. And we've talked about those differences where it's not a traffic citation, it's then all of a sudden something that goes on your record that can be contested in court. So that's the decision before us. We have heard from St. Luke's, their opinion. I think it would be really helpful before we get into the weeds on those two options to hear from Commissioner Hasbrook and to hear from Gina Pinnell, what they're observing throughout the county now that Central District Health has issued a countywide ordinance. So, Elt, if you're on the line with this, how is it working? I know you were one of the representatives that, as a commissioner, that sit on Central District Health. So give us your size up. Are things going well with people following the rules with wearing a mask?
Well, Mayor Giles, City Council, thanks for inviting me to your meeting. Can you guys hear me okay?
Yes, we're hearing you great. Look forward to your comments and observations.
Well, yeah, it's actually working quite well, especially in Ada County. When we first started this we didn't start this back in March, but we probably should have done this a little bit sooner in the summer, and I think we would have had better results later on towards this time of year. Two main goals, as everybody knows, was first of all not to overwhelm our medical system, and then the second thing that we talked a great deal about on the Health District Board was the fact that these kids are going to be going back to school, and especially the little kids need to learn how to wear a mask, that it's okay to wear a mask, so that parents can teach them to wear a mask and they get used to it. Both of those, as far as I know, have been really successful. As you guys have read, there's different sources. roughly around 75 cases from Valley County. The Star News has a little over 100, but some of those folks actually live down below. We've done a really great job of keeping our numbers down up here. I'm really happy the way that works out. And right now, our biggest concern is how are the schools going to work? What kind of disease effect are we going to get if with teachers and staff and parents and grandparents for the kids going back to school? And I'm really hoping that we can keep the mask mandate until we know for sure how that's going to work out. Other than that, I'm open for questions.
Great. Council, this is a great opportunity to get it right from the source, from Central District Health. ELT is our commissioner that sits on that and has seen all the history. So, Tom, do you have questions for Commissioner Hasbrook?
Sure. When does it end?
Well, that's the thing that we're trying to work on now, is basically design some metrics that will show if we get a 10% drop or a 5% drop. If you follow the timeline along throughout the summer, you can kind of see when you guys put the mandate on and when we put it on, how the numbers immediately started dropping. And so there's a pretty good correlation between wearing the mask and washing your hands to the folks up here that are getting it. The other issue that's in our mind, go ahead.
Yeah, go ahead. No, you, sir.
Well, the other issue is with these kids going back to school now, I hope we're not going to see as many travelers up here. There's also the road construction that's starting, I think, next week down the canyon. I think that's going to kind of discourage a lot of folks from coming up here. So I'm hoping that maybe by the end of September, we can go back to volunteer and do away with the mask mandate. That's my hope. But we just really have to see what the numbers come back from the schools.
Okay. Well, in March we had what, one case, 2 cases maybe. April we had 0. I'm looking at CDC. I'm looking at Central District Health's website right now. Then when we started testing, we had cases, but we didn't have hospitalizations to go with those cases. And so, you know, I don't feel like we need to continue these draconian measures in the effort under the guise of safety. But I do appreciate your input, and I think everybody kind of knows where I stand on this issue. So,
well, Tom, this is let me remind you, back in March when this started taking off and getting really bad, we are a 4-county district, and in Ada County it really blew up.
And we're still not Ada County. We still continue not to be Boise.
And I hope we never become Boise, but let me finish my point. Immediately when it took off in Ada County, they immediately filled up a lot of ICU beds. They had about 530 beds available throughout the Treasure Valley, and they got up to 480. And it really started scaring folks. And since then, those numbers have come back down. Everybody's doing a really great job to try and, self-isolate and doing a better hygiene job as far as washing and wearing masks. So now we're around 200, or maybe even less now. And so those hospital beds are back available. But in March, it really freaked out a lot of people. And it was like, what happens if we lose our doctors up here or our radiologists? We don't have anybody up here to take care of us. So if you break your arm or you need, stitches, you have a heart attack, you're going to have to go to Boise.
Well, you have to go to Boise anyway if you have a heart attack. We don't have a heart attack unit here. This ridiculous things that we keep saying about we have to go to Boise. Everybody has to go to Boise.
Well, not to get something sewed up or not to get a broken arm fixed.
Well, right, but you said a heart attack. And
well, I'm just saying,
if I have a heart attack, I have to go to Boise.
So, Tom,
yes, but if there's no doctors in McCall or Cascade that can see you, then your chances of survival are a lot worse.
Right, and it's stabilization, packaging, and shipping. I fully understand. Right. I mean, I listened to you on the Central District Health meeting. You said 10,000 people a day are dying in Brazil because they won't wear their masks, and that's blatantly untrue. And so for you to sit here and cite statistics to this group I don't even know where it comes from.
Well,
So
let me ask
Tom,
you
I'm
this.
gonna,
Would
we're
it
gonna
be better
move on.
not to do anything?
We're gonna move on to Melanie, and Tom, I do understand your position. You stated it real clearly, and
Thank you, Mayor.
we'll get back to that. And yeah, Melanie, questions for Commissioner Hasbrook?
Commissioner Hasbrook, thanks for being with us. We appreciate it.
Sure.
I only really have one question, and that is if you can kind of, in broad strokes, tell me what the difference is between the Central District Health Order is and the City of McCall order.
Well, it's kind of interesting because only city councils and mayors and the governor can issue mandate orders. The health districts really don't, or excuse me, the county commissioners don't have that authority.
Right.
However, we got to the point where seeing all these people coming up here on the weekends from two of the most highly infected counties in the state, it just made sense for us to say, wait a minute, we're just asking for trouble here. We've got to do something to get ahead of this. And that was the main emphasis, was, to protect our local people. I care about the people in this valley and I want to protect them.
So, Counselor Holmes, I think I can take a stab at answering your question in a different way. Thank you very much, Commissioner Hasbrook. So the City of McCall Emergency Powers Ordinance and does not allow us to, and I believe this is per the state law, we don't have authority over school districts, where I believe the Central District Health Board can impose conditions on school districts. So that's one difference. Our mask resolution, the penalty is a $100 civil fine, as you know. The penalty under the Central District Health Order is a misdemeanor. So it's a criminal situation, which is what we had started out with, and realized that it wasn't workable for us as a city to issue. We didn't have the authority to create a misdemeanor in the state court system. However, Central District Health does. And again, Chief Williams is on the line and can speak to the enforcement side. And I think those are the two primary differences between Central District Health's order that they issued for Valley County and the one that the City Council has done for us locally.
Thank you very much. That helps me, and I'm good. Thank you.
So let's go to Chief Williams real quickly. I'm going to ask you to be very brief, like less than 3 minutes. Let's suppose, Justin, that council tonight decides to let the city emergency order lapse. Again, my words. And on September 2nd, we come under Central District Health Authority as part of Valley County. How would that work for you and your law enforcement officers? Take us through that. What would we do if people were not wearing their masks?
We would continue to do the same thing that we've done since the city implemented the mask ordinance. And the thing that we've done throughout this entire endeavor has been rely upon a educational process rather than a punitive process. We've only issued the one citation for the violation of this, and that was, I think we have a court date coming up for that one. What we've done is really try to educate and gain compliance. That's what we're looking for. And we're seeing a higher and higher rate of compliance throughout this process simply because of the fact that it's becoming the norm now. People are wearing them in Ada County, in Caldwell Canyon, all these different places. They're coming up to visit and they are wearing them in those areas, but there is a high compliance rate here. The difference in the enforcement action is what we've talked about previously. With our particular ordinance, we recently changed it so that it's a civil fine. It is not the misdemeanor. We do not enter the criminal courts. It is a much more fluid process. It's a faster process. It does not affect a criminal record, whereas the other, falling under Central District's health guidelines and their mandate, it will be a misdemeanor, so it does go through the court system. However, from an enforcement standpoint, the criteria is still the same. How we carry it out is still the same. There will be no gap in our ability to take enforcement action should it become necessary. It will just go through a different process rather than our civil fine process. It will go through the criminal courts and be prosecuted by the city prosecutor. However, as I've said, repeatedly, we gain compliance through education and having discussions. Very rarely do we come across the people that are just obstinate and choose not to comply. That is a very rare case.
Thank you. Thank you very much, Chief. I think that was one of Melanie's questions too. It was certainly on my mind. Mike, your thoughts?
Thanks, Bob. One, I want to thank Commissioner Hasbrook, one, for his leadership with our county and with our greater community. And I want to say, Alt, I think that our greater community knows how much you care about this area and our residents. So thank you. And I also want to thank you for your work and representation of our county with Central District Health. I also would ask that the mayor or that all council members refrain from interrupting guests when they are speaking and when they've asked a question. It's just a side note. But so the question I have is, with Central District Health's mask order or mandate in place, that then essentially supersedes the mask order that the city has had in place. So therefore, is the city, maybe this is a question for Alt, Annette, or Justin, does continuing the mask order, is it necessary for the city when we have it, whether we vote to extend or not with the Central District Health? So can somebody answer that question? Is that for you, Justin?
Yeah, I can answer that. So with our ordinance in place, it does, the Central District Health does not supersede it. If we allow ours to expire, which would be a recommendation that I would make, that we simply roll back to Central District Health's recommendation, or to their mandate, that we allow ours to expire. Their mandate is until further notice. There is no expiration. It is on firm legal ground, just as ours was. There will be no difference. The only difference in it is that we do not have to come back monthly and renew it. We don't have to go through the process, which we can't. We have to have the emergency powers to be able to do that. It would be through October. We would have that gap. The simplest streamlined solution is to allow ours to expire and then roll back to Central District Health's. If we continue with our ordinance and it does not expire and we do what we're supposed to do to keep it going, it is not superseded by Central District Health's. Does that make sense, Mike?
Yeah, that makes sense. So yeah, Bob, I guess to answer your question on my input, it seems to me that the fact that we have the Central District Health order in place, it doesn't sound like it is then necessary to be redundant with the city mask order being extended, because we are covered in that way. And I absolutely support our healthcare community and all of those that are very concerned and have good reason to be concerned about the health and safety of our community. And again, I want to thank Alt Hasbrook for everything that he's been doing.
If I may, real quick, the purpose that we came up with the mask ordinance when it was implemented was the fact that there was nothing in place for Valley County, for the city of McCall. The council members took the brave step of going forth and treading into water that other cities had not done, counties had not done. And you took that initiative because there was simply a lack of support from other areas. Now we have that support from Central District Health. We have the rulings, we have the state backing. Therefore, it's not necessary for us to have our own ordinance. We have the mechanisms in place for enforcement action should it be necessary, and we can rely upon the state now.
Excellent. Thank you.
Thanks, Mike. Appreciate you asking those questions. Colby, you're up next.
All right. Yeah, El, thanks for being here and sticking it out through a long meeting to get to this point. I really appreciate what you do for our community. Like I said, the question that I had for you is, what do you feel like the likelihood of any change with Central District Health and the ordinance before September 18th?
Well, that's really kind of a hard question to answer because it really depends on what happens with these schools opening back up. There's a very small, slim percentage of kids that actually get very sick at an early age. I mean, it's like 2 out of 100,000 will actually get pretty sick. So the risk is fairly low in our school system. I do want to correct a statement made earlier, and I'm not sure who made it, about the health district controls what the schools do, and that's not the case at all. What we do is we go in and we rate a school as far as red, yellow, and green, and then that gives them some goals and some metrics to use to try and get back into a different or lower or safer class. But we don't go in and tell schools you have to mandate masks, you have to do this and do that. But we do work with the schools on setting up plans and how they can handle it. Some of the schools have hired nursing. Some of the schools have created kind of a quarantine rooms. They've broken up classes. Of course, many of them have gone online, and the schools are doing perfect what we need to have done. My feeling is, I really hope, honestly, that by the end of September that we can do away with the mandate, and it would probably still be a voluntary deal. But one of the issues that I dealt with right off the bat from a lot of folks, especially in the business community, was that they were asking for this so that they could tell their customers, you have to wear a mask to come in here, because that wasn't happening in our restaurants. It wasn't happening in a lot of our grocery stores where a lot of that transmission was happening. As soon as we did that, I got a lot of people calling and thanking me. Of course, I got quite a few that didn't like it either, and I've been called a lot of names, but I'm kind of used to that. And it took a lot of that political pressure off our business owners so that they can make people wear them when they come into their business, and that didn't happen before. And Justin's correct. You know, ours is will kick in if the city does not renew theirs. But I don't think you're going to see too many tickets issued for a misdemeanor citation. Just like Justin's been doing with his police department, our sheriff's department, all we do is educate and educate and educate. However, every once in a while you get somebody that's pretty obstinate, and sometimes you have to play hardball with some folks. But really, if you think about it, it's like, if you want to play with dynamite, go ahead and play with it. Just don't blow me up. And that's really what it comes down to as far as wearing masks. I hope that kind of helps and answers some of your questions.
Yeah, it does. Thank you. I appreciate it. You know, I guess for where I stand on it, I don't see the problem with extending it until it's gonna expire at the latest date that we can do it. I don't see that there's any harm in having redundancy, and kind of a fan of the civil fine rather than a misdemeanor. Should someone just have a really hard time complying with that. However, I feel comfortable enough that there is something in place, you know, to ensure we have that mandate there. But back to the other side of it, that is something that we're not in control of. And I am concerned that, you know, that potentially that mandate could end prior to September 18th. But that's just my concern and my thoughts. And that's, I guess, all I got for now.
Thanks, Colby. Thank you, El. So the two choices that we have before us are, do we want to let the cities ordinance expire September 1st? Or do we want to extend it and let it expire September 18th? That's kind of the short term, the two choices that we have. And I'm not sure we know yet as a council, but I think these discussions are helping us, and I'm going to call on another guest who is a project manager for Central District Health, and that's Gina Pannell. Gina, can you hear me?
Yes, Mayor Giles and City Council, can you hear me?
Yes. So one of the things I asked Gina when I talked with her on the phone today was to share some numbers as far as how the trends are going in Valley County. And some of the data, of course, does not include people that are not residents, but Gina has access to the St. Luke's database and perhaps the data coming out of the clinic at Cascade. And I think that'd be really helpful if you could share your insights. So what is happening? What are the trends in new cases? Where do you think things are headed? And if you could give us your view. We heard from ELT and about the dates, but my perception is that probably Central District Health won't make a change until the earliest would be the end of September, but I could be wrong. So give us your crystal ball view of when you think changes would be made the earliest.
You bet. Thank you for the opportunity and good evening, everyone. So Central District Health is seeing decreased cases in Valley County. We're pleased to see there was a couple weeks there was 10 to 15 cases per week, and that's down to, I think it was 3 last week, and so far just 1 this week. And those are the trends in the right direction. When it comes to capturing, true case numbers, positive cases, we're aware that or if you're not aware, that cases are attributed to the county of residence. So when you do have visitors there from multiple areas, whether it's from other places in Idaho or other states, those are sent elsewhere. And based on what, St. Luke's McCall showing and Cascade Medical Center, they do have different positive test results that don't necessarily reflect the 3 that we've seen in the last week. And so there continues to be cases there that aren't attributed on the data. So I bring that up to point out that the numbers are good. They're in the right direction, and it's never going to be a true representation. And that's honestly true for any county. We have visitors here in Ada County like you do in Valley County and other counties, Elmer County, et cetera, throughout our health district. And one of the things that I want to bring up as it's related to the mask mandate is that one of when you look at positive cases, you want to identify if it's from a close contact or if it's community spread. And again, a close contact is a known exposure, is someone who's known to have tested positive and then exposed another person. And community spread is in the indication where you don't know where the source of exposure came from. And then the third one is actually called indeterminate, and that means there's multiple potential types of sources. So it could be that they had a known contact and attended an event where there was an exposure, and so we can't make a determination one way or another where they actually picked up the virus. And we're still seeing all of those. So that is something that we look at when we come to different interventions, because if it was just that contact to contact, you can isolate and quarantine and continue that process and keep generally the community safe. But when you're seeing community spread still and you don't know the source of infection or the source of exposure, then that's an area of concern for us. So those are the 2 things that I wanted to bring up. I think when I think about projections, our Board of Health reviews these orders for any county, any public health order every time they have their special board meetings, which is weekly or bi-weekly in the event that we have a regular board meeting scheduled. So I think data will be looked at and assessed on an ongoing basis. I share in the sentiments of Commissioner Hasbrook in schools reopening and knowing that and expecting cases to come from that. You have groups of kids that are spending time with each other, but in a school setting, that's just much different. And the superintendent, Bowdy up there, has done an incredible job and is working really hard to implement measures, including masking and requiring masking following our public health order in a school setting. And so I think, there's a good chance that it won't be a huge impact, but that's something we're not going to know because schools just didn't open after March. And so we're not quite sure what to expect. So I think that that's one thing that to consider. The other couple things that come to mind is knowing the climate up in Valley County. You've had the summer, people been outdoors, you've had patio spaces, you've had lots of fresh air and opportunities to do that. And we know that those are going to start become limited and people are going to move indoors. And when you share that indoor air, that's one of the things that can potentially impact spread. And to top it off, we have flu season right around the corner, comes in September, October. Starting. And so those combinations just, I put a big question mark out there and make that crystal ball even fuzzier than it already is. And so I don't have an estimation of when I think it will or could be lifted, but I know that we'll revisit it on a weekly board meeting to look at the data and the trends and the impacts of school and the impacts of weather and all the things that are forthcoming here in the next few months.
Thank you, Gina. Yeah, we're asking hard questions that if you were asking us, we couldn't answer them either. So, so here's one last hard question for both Elt and Gina. If we let our mask ordinance, the city ordinance, lapse on September 1st, do you think we'd have any different results here in the city versus if we extended it to September 18th?
This is Elt. I don't know who wants to go first, but I think the thing to keep in the back of your mind is the 7th, September 7th is Labor Day, which is a huge weekend up here. And then the following day, they start closing the highway down at Smiths Ferry. I feel like if you were to let it lapse on the 1st of September, it kind of sends a bad message out to some folks that, okay, it's not as serious anymore, so now we can stop wearing the mask. I hope you keep that in the back of your mind trying to make up your decision.
Thank you. No, that's a really good observation. So under that kind of thinking, we would provide let's suppose Central District Health kept their ordinance on the books for Valley County till the end of September. It would be a transition then if we extended our city one till the 18th, then we would come under the county and everyone would know how that would work. What's your thoughts, Gina?
I agree with Elt in the sense that you have potentially a large number of people coming up to visit. And when I think of Chief Williams' responsibility there, he probably would rather have not a misdemeanor in his back pocket to be able to pull if he needs to, and of course focusing on the educational process. But I know with visitors that's maybe a little bit different than your local community. And so if you want to continue to have that and you think you can use that tool and it's feels a little less harsh, or your community will have better buy-in and it will protect you over that course of the Labor Day, I think that would be a recommendation. At the same time, if you don't feel like you would move beyond the educational components, then I don't think it would necessarily matter, knowing that you've only issued one citation. But given the Labor Day, I think that's a big consideration, and transition periods are always beneficial. Nobody likes change, and we've just been in a sea of change. And so to kind of continue that for a little while longer, I think would be added value.
Thank you both for your comments on that. I'm going to go backwards in our order. So one last chance before we make a motion to do one of those two options. I don't have any further questions. Colby, do you have any questions for Elt or for Gina?
No, I don't have any further questions. Thanks. And thank you guys both for being here.
Mike?
I don't have any further questions and I'm ready to adopt resolution 20-20.
Thank you, Mike. Melanie?
I don't have any further questions, and thank you both for being here again.
Tom?
No, I don't have any further questions.
Okay, I think we'll use our same procedure we did on the last really tough one, and that is I'm going to ask council if there's someone that would make a motion for resolution 2020, extending the mask mandate directs Okay, and just, we'll stop and authorize the mayor to sign all necessary documents. And if that motion is made and seconded, then we'll do a roll call vote on it. If it stalls out and does not get a second, then we'll move on to the other option, which is, I guess, to let it lapse. So, would someone like to make a motion to adopt Resolution 2020 extending the mask mandate and authorize the mayor to sign all necessary documents?
So
Yeah.
moved.
There we go. I
Okay,
will second it. It's Mike.
sounds like Melanie made the motion and
Mhm.
Mike seconded it. Is that correct?
Correct.
All right. May I have a roll call vote on that? There's been a motion made and seconded to adopt Resolution 2020, extending the mask mandate and authorize the mayor to sign all necessary documents.
Councilmember Holmes,
Yes.
Councilmember Machezek,
Yes.
Mayor Giles,
Yes.
Councilmember Nielsen,
Yes.
Councilmember Sowers,
No.
All right, that motion carries. And we all understand that it expires after September 18th. So it provides a transition. If the Valley County order, which is actually a Central District Health order, if that remains in place for Valley County, then we would come under that authority on September 19th until Central District Health would rescind their order. Am I capturing that correct, Annette, Gina, and Elt?
Yes, sir.
Okay, thank you. And thank council. This is another really tough one. I appreciated everyone listening to the experts, reading the materials, asking great questions. It's not an easy decision, but thank you for making a decision. With that, where are we, Annette? Are we into COVID?
Yes, we're just have 2 items left. The COVID update with Chief Williams, just segueing right into that from your last discussion, and then the upcoming meeting schedule. And then we will have you adjourn momentarily, and then we need to have you reconvene in an executive session that's listed there on your agenda. And Bessie Jo will give us instructions on how to do that.
Great.
Um,
Let's proceed. Thank you for helping.
Yeah, so we've already heard quite a bit from our guests, Gina and Commissioner Hasbrook. Again, thank you very much to them for participating. There was a regional COVID task force phone call today, and the reports from St. Luke's and from Cascade Medical Center mirror what you just heard. The situation is improving locally. They are very positive that the behaviors of our community towards positive behaviors with mask wearing and good hand hygiene and physical distancing is making a difference. They're all, waiting to see what happens with school reopening. I guess that's the next big question mark. And that's about all I have, unless Justin has some additional information to add about our situation here locally.
I don't necessarily have anything further that needs to be added. We have the state totals. There's a 25% increase in comparison to the last council meeting on 8/13, which is a reduction in comparison to what we have been seeing statewide over the last few months. We'd seen 77% the time before that. So 25% is good. We're still in stage 4 until further notice. Town is very busy, so it has not slowed down at all. I think we've pretty much covered most of the COVID update with the previous conversation. So unless you have questions, please let me know.
So the one thing we did want to talk to all of you about under this topic is your comfort level with returning to city council meetings in Legion Hall. The construction work along Park Street will be substantially complete, or at least to the point where we can have access to Legion Hall and ADA access to Legion Hall next Tuesday, September 1st. We'll be having our first P&Z meeting in there with reduced capacity, of course, to ensure the physical distancing, etc. And so Bessie, Joe, and I did want to touch base with council to see if you want to continue virtual meetings in September again, or if you would like us to start transitioning to a more hybrid meeting where most or all of the council is in Legion Hall, and then we manage the capacity of who else can be in the room and public involvement, still provide, I believe, an online option. Is that something you all would like to give some feedback to us on about when you're ready to start transitioning back to a more normal council meeting environment?
Yeah, let's talk about that. Tom, what's your opinion on that?
I'm fine with it.
You're fine with going with the hybrid
Yeah.
at Legion Hall?
I'd much rather be there together with everybody.
Okay, thank you. Melanie, what's your thoughts?
I'm not really ready for that yet. Personally, I'm not prepared to be in that confined room with other people.
Okay, thank you, Melanie. Mike, what's your thoughts?
Same as Melanie. I
Okay.
prefer to stick with the virtual through September, or at least until we get to our last meeting in September, and then have that discussion.
Thank you. Colby, what's your thoughts?
Yeah, I really miss in-person meetings. But I'm kind of with Mike and Melanie a bit. I don't know if there's a way to do a hybrid, or I know I'm going to be in a physical location tomorrow morning. You know, do we have the option to show up to a meeting? Like, what does it look like?
Yeah, it'll be pretty much the same as it is now, because we do have to have the in-person option. It will just be significantly limited. We're going to measure it out for sure on Monday, but it'll be somewhere in the neighborhood of 10 people will be about the occupancy level of Legion Hall with the social distancing. You know, a hybrid is something that will have to happen anyway because of the limited number of people that will be able to attend.
So it sounds like there's still some concern, and I think we need to be sensitive to that. I wonder if, so right now we're doing the location. People like Mike and Colby have been helping with being the person over at the community center with one person, elected official. It sounds like there's some sensitivity into getting 5 of us together, and we should acknowledge that, and probably for the month of September continue on with the model that we're using now. And the only thing that would change, it sounds like, is in September we would have our one elected official would be down in the Legion Hall. Does that continue to meet open meeting law?
Yes, so as long as we have one elected official and a member of staff in Legion Hall, it also gives the opportunity for any member of the public to participate in person at a limited number.
Sounds like that's a prudent way to go, and like Commissioner Hasbrook told us, we're not through Labor Day yet, so that's not till around September 8th. Maybe being a little cautious and tying this to when the thinking about when Valley County and Central District Health says, gee, things are going well enough, the mask mandate countywide can expire. Maybe that also would be the time that we could feel safe about having 5 of us in the same room, along with some members of the public. How does that logic sound, council? Anyone have strong disagreement with that?
That logic sounds good, Bob. I mean, one of the concerns for me is Legion Hall isn't exactly ventilated.
Correct.
So, you know, I feel a lot more comfortable being over here at the community center right now with the windows open, the door open, and the fan going.
Yep.
So I think your suggestion is excellent.
Okay. And by the way, did you have anyone show up tonight, Mike?
No, just Robert Lyons for the portion on planning and zoning.
Right. And thank you for taking care of that duty. I really appreciate it.
You bet.
Bessie, Joe, and Annette, are you guys okay with that? I think that's what some of the council would like, and it's a health issue, so I want to be sensitive to that.
Yeah, I mean, we're here to support you and what the council wants to do, so it's totally your call. So whatever you feel you want to do, we'll make it happen. Make sure that it complies with the open meetings law.
Okay. All right, that's based on what I heard from all of our members, that's what I'd suggest we do.
Okay, we'll continue one more month and then check in again.
Thank you.
Yeah, no problem. So shall we move on to the upcoming meeting schedule? I'll keep it really brief. Just a reminder, tomorrow morning, we'll be back on the computers again with Colby at the community center to do our work session on streets, local option tax projects, and the update on where we're at in implementing that and the projects that Nathan's proposing moving forward. So that'll be a good check-in. And then I'm not going to go into detail on any of the other meetings here. You have all the detail, but I will ask if there's anything that you'd like to have added that is on your mind that we don't already have. I would point out September 10th on your packet, number 8 about emergency powers ordinance. That one was a duplicate. So that's not actually happening on September 10th. Will be because we just did that tonight. So
We're ahead of schedule. All right.
yeah.
Great. Thank you, Annette. So the executive session.
I have a question on the upcoming meetings. Are we, will we ever be able to discuss like the future of the parks and the public works facilities here?
Yes. Yes. So internally, we are trying to put together and gather some more information on that topic as well as the library next steps. And so once I feel that I have what I need from staff and some good data for you guys, we'll get it scheduled. I hope that's enough of an answer tonight. I don't have a specific date yet when I think we'll be able to do that, but it will be before the end of the year, and it'll be related to our discussion with the library.
Yeah, great. Thanks. Yeah, I just wanted to make sure that was still on the radar.
Yep, it is.
So Annette, my preference would be to go through the proper process to get us into executive session and not take a break, but.
Okay, I'm gonna turn that over to Bessie Joe on how she wants us to proceed, because we should only have, the only people on the line should be the council, Bill Nichols, myself, Bessie Joe, and Kurt Wolf.
You're right. So we do have to, yeah, so coach me on how to do that the best way, Bessie, Joe, and Bill.
Okay, so we will need to have the motion recorded as part of the meeting. to go into executive session. Once it's been first and seconded and a roll call vote has been done, then I will make sure that only those people that Annette just named are on the call. And I will stop the recording at that time, and then we can proceed.
Thank you. So on our agenda, it has the language about executive session. There are 2 bullet items. I think someone makes a motion and reads those 2 bullets for the reasons to go into executive session. And then it has to be seconded, and then we do the roll call vote. Is that correct, Bessie Jo?
Yes, that's correct.
All right, council, on your revised agenda are those 2 bullet statements. The first one's land acquisition, the second one's records. Would someone read those, but say I make a motion to move into executive session for the purpose of, and then read those 2 bullet statements.
Sure, Bob, I'll do it.
Melanie,
I make a motion to move into executive session for land acquisition pursuant to 74-2061C to acquire an interest in real property not owned by a public agency, and records pursuant to Idaho Code 74-2061D to consider records that are exempt from disclosure as provided in Chapter 1, Title 74, Idaho Code.
is there a second?
Mike, second.
Thank you. Motion has been made and seconded to move into executive session for the purpose of discussing land acquisition pursuant to 74-2061C to acquire an interest in real property not owned by a public agency. And number 2, records pursuant to Idaho Code 74-2061D to consider records that are exempt from disclosure as provided in Chapter 1, Title 74, Idaho Code. May I have a roll call vote, please?
Councilmember Holmes,
Yes.
Councilmember Machezek,
Yes.
Mayor Giles,
Yes.
Councilmember Nielsen,
Yes.
Councilmember Sowers.
Yes.
Thank you, council.
Okay, I am going to stop the recording and